Okay, so welcome everybody. As I said, my name is Helen Curtis. I am a member of New Unity Church in Hackney. As you can see, we just had the agenda, but got rid of that. But we're going to start with Pete Briley, who's going to just give a bit of an introduction for today's meeting. That will be 5 minutes.
Thank you so much, Helen, and it's really exciting to see so many of you from across the UK here. I don't know who chose that wonderful music. Who was that? Own up. Was that you, Foy? It was you, wasn't it?
Yeah, it was me.
Some nice cheesy music to begin with. But as Helen said, a really important subject for us to be thinking about, and no doubt it's been on the top of your mind. Perhaps it's something you personally been struggling with, or you know lots of people in your community, but that it's safe to say that we all either have been or know someone that has been affected by having poor mental health. And I can say personally, Helen talked about lockdown. It's definitely been a struggle for me. I've got two very rambunctious children who you may hear playing the French horn as loudly as they possibly can because I'm on a Zoom call at the moment. Two full-time parents trying to work. It wasn't easy, but I was also fully aware that for me, it was a different experience than it was for so many other people. And at one point I was doing a project with SLAM, which is a mental health trust in South London. And we were trying to get a computer to one of the mums who was participating in this piece of work. And, she didn't have a computer to use. So I went over there. And when I arrived, she invited me into her home, but there was, she didn't have a garden. It was overcrowded house. She was a single mum. She was, very hopeful and joyful, but she also said it had been really, really difficult. So we're here because we know it's an issue that affects so many people. A study recently said that between 500 and 600,000 people more are likely to be accessing kind of acute mental health care. That is just simply not sustainable for the system that we're a part of. And this champion program is something that's been in the making for a while, because lots of our kind of chapters have been working on mental health. And we said, well, what can we do to bring the brilliance of Tyne and Weir together with the brilliance of Colchester citizens, to share some of that learning and to work together to tackle this issue. And so if you were thinking that this was going to be a course that's simply about training you to have mental health awareness, it's not. And I'm sure you didn't think that, because being part of citizens, you know that we're also about campaigning and thinking about our own institutions. So when you're thinking about what the Mental Health Champion program is over the next few weeks, I want you to understand it by thinking about three things. The first is, it's about the individual. It's about you. It's about hearing how other people are organising perhaps and training people to be more aware of the issues of mental health, how to navigate the mental health system. So that is important. We're not necessarily going to focus on that, but you'll hear from people who are doing exciting things in their own chapter, perhaps working with Mind, perhaps working with their mental health trust, to train people in that individual level of understanding about what mental health is. The second thing is that we're going to spend a bit more time on is thinking about our own institutions, whether you're from a university, a school, a mosque, a church, a synagogue, because our institutions have an enormous role to play when it comes to serving their local communities and thinking creatively about mental health. Somebody recently said to me that we are what we pay attention to. We are what we pay attention to. So how can we pay attention to people's well-being using community organising, the tools of community organising? So we want to come up with, at the end of this, cases of best practice from churches and mosques and schools about how those institutions are leaning into and being attentive to issues of mental health and well-being. And the third thing, which is no surprise to you, so if the first is the individual, the second is the institution or the organisation, the third is the systemic issues that we face. We know that locally and nationally, there are things that need to change. Whether that's Tyne and Weir, who've got a great example where they, young people said, we don't feel welcome when we go to those first sessions at CAMS because the waiting room is designed by people that are not like us. And so they work together with the Mental Health Trust to make it more of an inviting place, whether it's something as local and specific as that, but we can find common strands to learn from one another to do things locally and learn how one another are doing it. But we can also find those common strands that maybe could lead to something that's more national, something that perhaps national government to do something more about or something better. And we hope that as part of this process, and we'll hear from John Hall as well in a bit, who works with Engage Britain, who are also helping us think about this. We want to do something on that. And finally, the last thing to say is this is a community of practice. We're here together to learn from one another. Dr. Safraz Gerard, who's a leader in Southampton, said you can't get well on your own, but you also can't tackle some of the UK's biggest problems on your own. We need each other, the energy of culture citizens, the creativity of Leeds citizens, the cutting edge of Brighton citizens, and well, you get the idea. So I'm excited about what we can change in each other and with each other, and I hope that you're going to be participating, not just today, but over the next 5 sessions as well. So I saw the timer there, Helen. Did that mean I had 30 seconds? Was I well behaved there? I went a little bit over. Okay. So not setting the bar as highly as I should have done. So I hope that gives you a bit of a flavour of what it is we're trying to do together and collectively, because I think it's important to understand what it is you're joining. I'm now going to introduce, as we will, I hope, hopefully with each of these sessions, we want to introduce people who are experts in their own field, people who are thinking creatively about this issue from different perspectives. And it's great that we've got both John Hall and Sir Norman Lamb with us today, who are going to share a little bit each about what do they see as the challenge we face and what do they see as the opportunity, particularly for civil society, community organisations such as ours. So it's really starting very big picture. So I'm going to hand over to John, who knows he's got 3 minutes, between 3 and 5 minutes max, and we'll then get the timer. John is a former kind of strategy lead for the Department of Health and is now a consultant with Engage Britain. And it's great that you've been partnering with us on some of this, John, and we'd love to hear some of your thoughts. So over to you.
Thanks, Pete. Good afternoon, everybody, and thank you very much for inviting me along. You'd probably expect an old Treasury hand to start to machine gun you with numbers when we talk about mental health. But in my experience, it's all about people and their needs are very different. So I thought I'd begin by introducing 3 people from my life, Mary, Kevin and Tom, not their real names. Mary is bipolar. She's been in and out of what we used to call institutions all of her life. But severe mental illness was only part of her story. She was also the top of her year at a major UK university. I visited her on a number of occasions in her clinical environments. And what struck me about them is the clinical treatment might be fine, but the place I visited was not a nurturing environment for recovery. It was a genuinely scary and terrifying place. And this story doesn't end well. This incredibly bright young woman lost her job and her purpose because when she went on to work, her employer couldn't make the changes that Mary needed to sustain her employment. Next up's Kevin. Kevin was a teenager I worked with in the Midlands with the Prince's Trust. In his short life, he'd slept rough. He'd had a gun held to his head by his own sister on behalf of the drug dealer who she was going out with. He was a lovely lad he'd genuinely never been given a chance in life. And his life kept going off the rails. And when those acute interventions happened, Kevin seemed to get good treatment. But I couldn't help but wonder if he'd had a more nurturing network of support around him, whether his life would have gone off the rails quite so many times. And thirdly, and most recently, is Tom. He's a bright teenager I met on his Duke of Edinburgh expedition a few weeks ago. Nicest, most caring person you can imagine was Tom. And I was really impressed. And when I sat down with him at the end to give him feedback on just how well he'd done on this, he burst into tears. The anxiety of lockdown, not understanding what he was feeling or what it meant, and genuinely not knowing where to turn. So I introduced those 3 people, Mary, Kevin, and Tom, because as someone who spent most of their professional career in the Department of Health and Treasury, working on NHS spending, 2 things strike me as being very clear. Firstly, there never has been enough formal mental health services to meet the need. After COVID, there certainly isn't. And I don't think there ever will be. Even if a government had the intention and wanted to put the money in, where are those skilled, trained staff going to come from in the short run? So secondly, formal services, which tend to focus on curing acute episodes, is the right approach for some people. But for lots of other people, it's not. And the challenge I think we feel as citizens is, how are we supporting the much larger group who need help with their emotional well-being? Now, I'm not going to do a counsel of despair, it's not my nature, and I think there's 4 reasons to be really cheerful here. The first is treatment is getting more humane. We used to put people in asylums and lock away the keys, and now we provide supportive treatment in the environment. We used to give people pills which would numb the pain in their sensations, and now we give talking therapies to help them resolve it. Secondly, the evidence on what works is getting better. As I found in Treasury when we're introducing improved access to psychological treatments or therapies, CBT, based on experiments in Newnham and Peterborough, and evidence base, and a brilliant champion in Richard Layard. Thirdly, it's rising up the political agenda. I think some of the initiatives that Sir Norman Lamb, who we're about to hear from, has taken on that, is a big part of that. But fourthly, and I think most important for me, is that 10 years ago, people didn't have the language to talk about mental health. And they were embarrassed to talk about it because they had the stigma that they had a problem. And I think those things are slowly changing. Over the last few weeks, I've done a bunch of work with Pete, Tom and colleagues at Citizens to find out what local Citizens chapters have been up to. And genuinely, I've been really enthused by the amount of energy I've seen, and I'm sure as we're going to see today. So I've a final few thoughts from me to sort of harness that energy and not get overwhelmed by the size of the problem. The first is, pick off the problem that matters to you. Because it might be that there's not enough formal services for the people who really need them. But it might be that the formal services that do exist could be so much better in treating people. Or it could be that there's not enough support to help people with their well-being. What is the thing that matters to you? Bite that off. The second is, what concrete difference can you make at the local level to that problem? Is it a national local campaign for more money? But if it is, what do you want the money spent on? Do you want to help your local NHS redesign services so they're more accessible or better for the people who need them? Is it about changing the culture within your own faith organisation or school so emotional well-being is mainstreamed? Or fourthly, is it about linking institutions in your community so other people like employers can take this seriously? The final thing is, think about what you can do as an individual. There's nowhere near enough formal services. So what we do to refer more people into them can only get us so far. What can we do to build our own resilience and help support our friends and families and our communities with them? My final line before Helen just puts me on mute is one of the classic lines that people say to their friends when struggling with depression is, stay strong, your story isn't over. I hope for that, Citizens, in terms of our mental health, that this story has hardly begun. Thank you very much.
Thank you so much, John, for that excellent and thought-provoking presentation. Really, really good to hear, and great that you also referred to Sir Norman. It's great to have Norman Lamb with us on this call, and thanks, Sir Norman's been involved in a couple of things Citizens have done, as working with us in South London as well. He doesn't probably need much introduction, but just to say he is the former health minister. He's the chair of SLAM, South London Maudsley Mental Health Trust. So Norman, I'll hand over to you for a few minutes, and Helen will no doubt try to time keep you as well.
Thank you very much indeed, Peter. And I found myself agreeing with everything that John has just said. I think this is a time both of massive challenge because of the psychological fallout from COVID, heaped on top of significant unmet need of people who experience psychological distress or diagnosable mental ill health, many of whom, the majority of whom, don't get access to traditional services. So it's a time of great challenge, but it's also, I think, a time of real opportunity. I wanted to just mention an initiative that we've taken in the South London and Maudsley, which has involved Citizens UK. I should say, incidentally, that I received an email yesterday from Peter inviting me to take part in this. So I've only got a few minutes, I'm afraid, slotted into the diary to speak to you, and then I need to head off. But I'm a great fan of Citizens UK, and so I was determined to find the time to speak to you. So in the South London and Maudsley, when we were confronted by this existential challenge of the COVID pandemic, I suggested that we should call a prevention summit locally We cover 4 boroughs in southeast London. Over 1,000 people registered for that summit. And out of that has developed a task force, which is now developing a sort of public mental health response to the psychological fallout from COVID. But critically, it's the South London and Maudsley Mental Health Trust working collaboratively with the local authorities, with community groups, faith groups, and with third sector organisations. And during that summit, it was actually one of our psychiatrists who said in a very enlightened way that mental health trusts need to be seen as community assets, I would add, rather than ivory towers remote from ordinary people. But I very much endorse that view that we must be community assets collaborating with others in order to make people's lives better. And I think that, I suppose my main message to you this afternoon is the absolutely vital role for community in that collaboration. Now, Citizens UK are working with us on that task force. They will lead an outreach exercise to go out and talk to people across our communities to understand what their need really is and how we could help them with that. But in this sort of new collaboration, there is such opportunity for organisations like Citizens UK to play a very powerful part. I wanted to mention a book to you, which I found pretty compelling. It's by Johan Hari. It's called Lost Connections. And it identifies how in our modern world, we have so often lost connections with other people, with nature, for example, and we find ourselves isolated and remote from people and from nature in many of our inner cities. And so recreating those connections must, I think, be at the heart of our approach to. And that's where people within organisations like Citizens UK can play such a powerful part, building friendships, building connections with people, giving people the chance of a fulfilled life, a happy life, getting out and about, seeing nature, getting exercise, doing things with people to make life worth living. This is what can so often make such a difference to people's lives and can often be more effective than traditional clinical interventions. There is, of course, absolutely a role for clinical interventions in many cases, but so often we can prevent the need for that by a sense of humanity, a sense of connection, and a sense of caring for other people. So thank you so much for getting involved through Citizens UK in your communities. You have an absolutely central role to play in meeting the challenge that we face. And there is, as I said, an enormous opportunity to make a difference to people's lives. Thank you very much.
Thank you so much, Salam. We're very excited to be working with you on this really big project that we're.
The feeling is mutual.
Great. All right. Next, I would like to introduce James Potter, who has done a lot of work in his local community and institution, and it is a great example of a mental health champion. So James, can you talk us through your experience?
Sure. Can you hear me?
Yes.
Excellent. My name's James. I'm the chaplain at a large all-boys Catholic school in Wimbledon. And really, as a school, we realised that mental health was a huge thing and something we needed to do more and more to address. So we started a bit, as Pete said earlier, on that individual basis of skilling ourselves up. A number of us did mental health first aid courses and skilled ourselves up. And then we started to listen to our students more. And we identified some of the areas of weakness in our local area and our system, but also in our school, and some of the things that the stereotypes that we needed to challenge. and some of the signposting of how to get access to help and how to remove some of those barriers to access to help was hugely important. And then really Citizens came along, and we found in Citizens a whole host of other institutions, equally some other schools, but some other churches and YMCA, all sorts of different groups who were also passionate about mental health and wanting to make a difference about this as well. And thankfully, one of our member organisations was Southwest London St George's Mental Health Care Trust, which built this brilliant partnership between us as a community groups and an expert group who are really able to sit down with us and help us to design and think about how we can respond best to everyone's mental health needs. So one thing we did straight away was set up some mental health champion training, which was great for our school. We've got even more members of our staff skilled up in terms of their mental health knowledge, thanks to this broader Merton Citizens mental health champions training, as well as training up people through local churches, mosques, and other organisations. We then organised a conference amongst local schools to come together to start to discuss and find out those common themes across different schools about what students wanted to be done and what were some of the issues. And as a result of that, one of the things we did was to create a mental health charter, which we've been rolling out across our borough and beyond, to help give schools a framework to think about how we can build mentally healthy schools, how we can do all these things that we were hearing from our students about signposting services to them, about how to work with your local community, though also to advocate for an increase in services or a change of the design of some of the services where that was important. So that phase was hugely important, a really deep listening of the students and identifying the areas that we could do ourselves as school, but also identifying, well, here is our mental health charter, slightly in the wrong dimension up on the screen, but also what were some of the systemic issues that we needed to tackle. And two that came up for us, one, as you might always expect, is money. We went to our local CCG as a Merton Citizens group and asked for more money. Asked them to be putting more money into youth mental health and to adult mental health in a local area. Something that if we'd just come along as a single school in the borough, they probably wouldn't have listened much to, but coming together as this citizens network and they increased their funding by something like £2 million for mental health in our local area, which was great. Our other systemic ask that we had for them was to change the way students could access the CAM service, the specialised mental health services. They had one assessment centre which was at the far end of our borough, and students had to get a couple of buses to get there, and it was a very awkward way of them trying to access the service, and many people had been put off and not gone through with appointments because of the difficulty to access. And so again, we were able to bring the voice of these students to the powers that be, who probably didn't realise what a problem this was on the ground, and now they've changed the way that they deliver that first point of access to their services to be more spread out and in the community. So working on a number of different levels with the network that Citizens provided us within our local area, with the relationships it provided us with as similar-minded organisations, but also that relationship with the CCG, then that helped us make huge shifts forward and to help not just our school make huge shifts, have much better access, but help our whole community have better access. And that's my buzzer. Thank you.
Thank you very much, James. That sounds like some very exciting, very interesting work. Okay, next we are going to go into some breakout rooms for about 10 minutes, I believe. Froy's going to be putting us into those. And what we're going to get the groups to think about is, what are you learning about mental health within your local area or within your institution? I believe Roy will put us into those. And the question is in the chat there if you want to have a think about it while we're getting you into the groups. I'll go through it for 5 minutes, asking people to maybe expand on some of the things they might be saying in the chat. Let's give it a few more minutes for everybody to come back, but feel free to start putting your thoughts in the chat. So you get some more response. So the question is, what are you learning about mental health in your local context? So you just want to put some of the thoughts that you spoke about in your breakout rooms into the chat. That would be really helpful. I'll pick out a few for people to maybe expand on.
Helen, just because at a time, I'm wondering, let's just pull out a couple, and then I think we'll move on. Just we lost a bit of time with our breakout room shenanigans, so no, thanks.
That's fine. So John Russell talked about the impact of isolation amongst church congregations. Do you want to expand on that one?
Oh, I'm partly pulling together what different people said. So it was Bex, who was from Colchester, who was talking about connectedness in higher education and employment sectors that were being particularly badly affected by furlough. And we see the same thing in church congregations. I think particularly with the rule of 6 that's just come in now, that means that we have no socialising either before or after the church service, and our congregation likes to hang out and chat for an hour over coffee. I mean, so that's a huge change, that people now turn up for a service, have to wear a mask throughout, and then at the end of the service we're saying, sorry, but you need to leave immediately. So we're trying hard to come up with some creative solutions about how we maintain connectedness during this.
And then we got Tyler, you talked about changes to going to university and the impact of that, of how the impact of COVID on going back to university and how that's felt. Do you want to expand on that?
Sure. So I've just started what would have been my final year of university, a year ahead of schedule. I've had to switch my year abroad around. And the thing that I found, especially in my cohort, who everyone has had this, is that not only have we jumped ahead a year of where we thought we were going to be, but everything we're doing now, which was going to be scary at the best of times, has now been made even more overwhelming because we're doing it in an unfamiliar way, adjusting to digital teaching, being online in seminars, and that real vulnerability of studying and being open about your private, being in your private space, and opening that up to people who you may be intimidated by or who you want to impress professionally. It's really difficult, and it's making very basic tasks associated with studying even more overwhelming than they would be at the best of times. So a lot of us are very overwhelmed, myself in particular.
Yeah, no, absolutely. Okay, so I think in the interest of time, we've next got a 5-minute break. So just for everybody, just to go grab a glass of water, go to the toilet, all of that good stuff. So we'll be back in 5 minutes, so 5:55, and then we'll start back.
Roy, you're going to put some mood music on again during the break? Yes.
We'll start back up in a minute.
Helen time.
Perfect. All right. So welcome back, everybody. We are next going to hear from Dr. Michelle Hampson from Nottingham Healthcare NHS Trust. Michelle, you have 10 minutes for your presentation. What do we mean by mental health well-being and the injustice and stigma and discrimination that happens within mental health? So
thank you. So it's quite amazing, isn't it? We're all passionate about mental health and we've been talking about it for over 45 minutes now. But what do we actually mean by it? And do we mean the same thing? So I wonder what that word mental health says to you. And it's a question I often ask people. Is it for you a positive thing or is it a negative thing? So I'm going to show you a couple of wordles that have come up from me asking that very question. So here is the first one. So here you can see that people are talking about some quite negative things, aren't they? About darkness and despair, but also positive things like compassion. So about how we should be supportive and understanding. And that came from a group of clergy. But you'll see that the next wordle is quite different. If we can have the next one, that is largely negative, isn't it? It's all the difficulties that you can face when we're struggling with our mental health. And so you may wonder, how have we come to this situation where sometimes people think of it as a positive word and sometimes a negative one? And I remember in the 1990s when I started work as a psychiatrist, I worked in a mental illness unit. But then it was rebranded to a mental health unit, but the work I did was just the same. And what people were trying to do was to overcome the stigma that would make it difficult for people to access our services. And people felt that the term mental illness was too negative. One of the things that I like that's come up from the service users is the term mental health challenges, because that talks about mental health as something positive that can be challenged, not necessarily as something that is a problem, but certainly something that we need to address. And so that brings together the positive and the negative. So we've talked today about mental health and we talked about well-being. And we're now going to watch a fabulous video from Student Minds that talks about how the two are related.
Mental health. So when you hear the term mental health, you might be quick to think about mental health difficulties. And people used to think of mental health in this way as somebody being either really well or somebody being ill, but actually that doesn't reflect what people's experiences are. We should be thinking of mental health as a continuum, and we can think about it in two dimensions.
On this continuum, we have mental health difficulties. Over this side of the continuum, we might have people who never identify as having experienced a mental health difficulty. As we move towards the other end, you may find people who do feel they have personal experience, and maybe they have a specific diagnosis. An eating disorder or psychosis could be an example. The second dimension to this continuum is our mental well-being. Well-being refers to how we are generally feeling about life, our ability to cope with the normal daily stresses, to be productive and to contribute to relationships, be those with housemates, with sports team members, or in an academic group project. So with that framework in mind, let's look at a few examples. Ben plays rugby for the first team. He's had a diagnosis of psychosis, so that may put him towards the far end of this horizontal axis. Ben does, however, have lots of strategies in place to help him manage these difficulties. With the right medication and a strong support network of family, friends and professionals, Ben is really flourishing and his mental well-being is really high. Now let's take another example. Natalie has no diagnosis of a mental health difficulty and doesn't feel she's ever experienced one. But it's exam time, a very stressful time of year, and in order to prioritise her revision, Natalie's cut back on doing the things she enjoys. So she's not spending as much time with friends, she's not going for her morning swims, and she's realised that she's starting to not feel so great. Her mental well-being has really started to drop.
Thanks. So the only thing I would say about that video clip is I'm not sure there's anyone who has minimal mental health challenges. We all have mental health challenges, and most of us at some point in our lives will actually have a mental illness. That's our current situation. But otherwise, I think that's a great video. But let's just have a thought about what do we mean by well-being, because perhaps that wasn't unpacked very well. So this is my definition, that well-being is a subjective assessment of contentment with ourselves and our response to our circumstances. Now you can see there that there's a tree that's a bit windblown. And what I like about that is that tree is flourishing in difficult circumstances. And that's something that well-being offers us. How do we make the most of a situation, whatever that might be? And I think there's two key factors that are important in this. And the first is to have a really good sense of who we are and of our worth, and that that's not influenced by other people. And it's not influenced either by when we mess up, to know that even if I mess up, I'm still an okay person. Personally, I'm a Christian, and I have to remind myself that I'm God's beloved child, and there's nothing that I can do that will make God love me more or less. And that gives me my security. The second comes from thinking that our lives have got a meaning and purpose, and that's what gives us hope. So we don't need to compare ourselves with others and how well they're doing. We just need to think about, how am I doing? So I used to ask patients, what, at the end of their lives, when they look back, what would they think had been really important? What mattered to them? And they would all say loving relationships. What they wouldn't say was that it was about their work or their possessions. And yet I'm not sure that we always focus on those things that at the end of our lives will truly matter to us. The advantage of thinking about well-being is that when things are difficult, we can remind ourselves that those difficulties won't last forever and that I am still significant. Well-being isn't about happiness that depends on things going well. It's about this sense of being able to be content in all situations. So if we learn to maintain our well-being, as it said in the video, we begin to protect our mental health. We reduce the risk of becoming unwell, and if we are unwell, it won't be quite so severe. The other day, I'd been talking to friends and hearing about their children, and I found my mood just plummeted as I thought how difficult life is for young people at present. And I really had to focus over the next couple of days on my well-being in order to get my mood to lift again, which mercifully has happened. So I think it's really important that we focus as much on well-being as we do on mental health when we think about the things we want to get involved with. But now I've been asked, as you can tell, to talk about stigma and discrimination. So stigma is being perceived to be different, to be marked out. And people with mental health issues often feel that they are viewed as different. In fact, people in the past used to talk about being a schizophrenic or a depressive as though the illness somehow defined you. Fortunately, we get less of that nowadays. We can also self-stigmatize ourselves by feeling if I've got a mental health problem, it means I'm a wimp, I'm weak, I'm inadequate, I ought to be able to pull myself together because that's what everyone else tells me. Discrimination, on the other hand, is being treated differently by virtue of something like one's mental health problems. And that's certainly true in the field of employment, which makes people reluctant to talk about their difficulties. So if we think about what the problems are, in terms of stigma and discrimination, well, it means one can become quite isolated. You may not want to talk about your difficulties, you self-stigmatize, but also long-term relationships become harder to sustain. You're far more likely to be unemployed or underemployed, have poorer housing, and these are factors to do with poverty. if you have mental health problems. And all of the stigma and discrimination means it's really hard for people to share that they have mental health difficulties with anyone or to seek help. And of course, that means that they are unlikely to seek help at an early stage, and it may even increase the risk of suicide because you can't tell anyone what's happening. So all of the stigma and discrimination adversely affects people's mental health. So on the previous slide, it went on to say that the Mental Health Foundation found that nearly 9 out of 10 people with mental health challenges say that stigma and discrimination have a negative impact on their lives. So this then is a social justice issue, but there is also this political justice issue. So there's a lack of parity of esteem. So a previous government said there should be parity of esteem between physical and mental health in terms of NHS funding. The reality, 28% of the burden of disease in the UK is mental health, but only receives 13% of the NHS spending. With COVID, we hear quite a lot about the physical health aspects, but not much about the mental health aspects, but they're there. Equally, recently, we heard that 16 clinical commissioning groups falsely claimed that they had spent the money needed for the mental health investment standard, when in fact they hadn't done so. And I doubt that they'd have done that in an acute care setting. So that's where political justice comes in. So the great news for citizens is we can make a huge impact in terms of our well-being, and our well-being affects the well-being of others. If our well-being is good, the well-being of those around us will increase. Secondly, we can be trying to tackle the stigma and discrimination that makes life more difficult for people with mental health challenges. And thirdly, there's that political dimension as well. Thank you,
Michelle.
Fabulous. Thank you so much, Michelle, for sharing that with us. And it's a joy to work with you in Nottingham on this issue. My name's Pete Rogers. I'm a community organiser in Nottingham. And we're just going to spend a few moments just thinking and sharing with you about the sessions that are to come. So this, as you will know, is the first in a series of 5 training and learning sessions. And I hope that you are building an excitement about not just learning how community organising is connecting into the issue of mental health, but also, firstly, about how you're going to learn from this amazing collection of 70 odd people who are coming with a whole host of experiences and talents. And my 1-year-old is trying to say hello. So we'll try and move on. So we're going to hear from Tom Chibo, colleague in Leeds, in a moment about the final 2 sessions about how we think about the systems, some of those systems that Michelle was just speaking about. But first, we're going to go to Daniel McIntosh and Phil Warburton, who are going to speak into sessions 2 and sessions 3 about how mental health connects into the organisations which we're coming from. So over to Daniel and or Phil. Are you with us, Daniel? Okay, we will hold on for a moment, and perhaps if we go to Tom Chibo first, he's going to introduce sessions 4 and 5, and then we'll come back to Daniel and Phil.
Hi everyone, I'm Tom Chibo. I'm a community organiser with Leeds Citizens. So sessions 4 and 5 on this journey are about thinking about systems and the wider political consequences of our organising. They're about making change in your neighbourhood or your city or across the country. In Leeds, we've had a recent win on our mental health campaign, which we've been running for a number of years since we started, which basically led to people from around the city having access to a mental health worker through their GP surgery. And that came out of lots of testimony and lots of action that leaders at Leeds Citizens took, and many of them are on the call now. And I tried to kind of tally and tot up all the different groups and organisations that we had to do an action on or engage with in a meeting in order to get that win. And it was vast. We were talking about the clinical commissioning group, individual GPs practices, our local authority, the local mental health trust, a range of third sector organisations, even NHS England. At some point we had to engage with and understand and connect with all of these different organisations as we were running our campaign. And the leaders on this call all play different parts in that journey. So in our final 2 sessions, we thought it'd be really helpful to share a little bit of power analysis and understanding to help every organisation here make a similar journey, understanding who has some influence over mental health systems and care in your city and in the country, and what's the best way to take action or to build a relationship so that those organisations can work with us for positive change. In order to take part in the session, you'll need to do a little bit of thinking about the place that you're from and the organisations around you, but hopefully the frameworks and the tools that we provide in those sessions will spur you on to taking meaningful action locally and joining together to get national change too.
Thank you so much, Tom. And Phil is now with us and is going to share about sessions 2 and 3. Thanks, Phil.
Yeah, thanks, Pete. Sorry, I'm sort of looming out of the darkness here on my screen. My name's Phil Warburton. I'm a community organiser in Tower Hamlets in the East End of London. I'm also a church pastor that's worked here for over 20 years. And our church has long been thinking about what well-being means, what well-being, our emotional journeys and our faith journeys and how that all works together. And as a church, we have many people who, in our church congregation, who have mental health challenges, as we all do. And so I'm really interested in this part of the training. And we're going to look at working back from the last session, which is looking at how we change things systematically. We're going to be thinking about how we can change things in our own organizations and community groups. So how can we, the first session we're looking at how we organize for well-being in our institutions, in our organizations, in our community groups. How do we do that? How do you do that effectively? People spoke very eloquently about the importance of community. But community is a slippery word. You know, what does it mean? What does it look like in action when we're actually supporting each other in our communities? So we're going to think about how our institutions, how our community groups can support each other. And then the next session, thinking about how we can sort of build relationships with other organizations that can support our well-being. And we can begin to build the sort of relationships we need, the relational power, we'll talk about citizens, to do the work that Tom is going to talk about in the final 2 sessions. So that's what we're going to do in session 2 and 3. I'm excited about it. It's important to my other job, and I can see the importance of institutions being ready to be part of the solution, not just to offer solutions to powerful people, but actually be part of the solution with well-being and mental health.
Thank you so much, Phil. So we're going to go back into breakout rooms, and I'm going to hand over to our chair, Helen, who's just going to introduce them and the question that we're going to be using to build our own perspective of what we want to get out of this learning community together. Helen.
Perfect. So yeah, we're going to have another 10 minutes or so in a breakout room where we want people to think about what you want to get out of these trainings. What do you want to learn from them and what do you want to get out of them? So we're going to spend 10 minutes doing that, and then we'll be feeding back into the chat like we did the last breakout room. Yeah.
Also mention the Jamboard as well. I'm posting it in chat.
Oh yes, we're going to be putting some of our responses onto the Jamboard, which will be, each of the rooms will be connected on the Jamboard, so you'll be able to see in the end what everybody has been commenting on it.
Great, thanks, Helen. I think it's really important to say, because it's a community, the idea is this is a community of practice. So partly it's like, what do you've heard the kind of outline, but what do you want to learn? What do you want to give? So do put that in the Jamboard, that'd be great. Welcome back after the breakout. I hope that was a useful time to begin to think about what you and your institution might need to do going forward. we've come to the end of this evening, and I certainly found it engaging, interesting, inspiring, and I hope you have as well. I hope it's also clear to you where we're going with this and how together we can go on a community of learning to understand and equip ourselves in terms of mental health. As we said at the beginning, we're looking at kind of the individual and how we can equip individuals to think about mental health. The institution, the organization, that's your church, your mosque, your school, your synagogue, and how do you orientate yourselves towards doing more using community organizing around this issue of mental health. And finally, how do we begin to challenge the system and learn from one another about how that can happen? Next week's, not next week, the week after next is going to be the 14th of October. It's at 5 p.m. We encourage you to come, but also think about who you could bring with you. Who could you invite? So your homework for next week is to think about who else could you bring with you, so that when you come, you can think with other people about your own organization and what you might need to do differently to lean in and be attentive to the issue of mental health. Thanks for joining us. A really good evening to you all, and we look forward to seeing you in a couple of weeks' time. You'll get the PowerPoint, you'll get all of the resources from this in an email, and we do ask you to send that link on to others that you'd like to join as well. Okay, thanks so much. Bye.